Welcome back to Metropole Television. You're watching a Business AM. So the question is therefore, if you look at these numbers in the country, you have this one man called your president who's saying, well, we are not supposed to go back to where we've come from in terms of the restrictions that we've brought into the economy as a result of the COVID-19 pandemic. Just before we cross over to Mr. Kimitai this morning, the question is this, Daniel, why don't we have the political class being at the forefront of making sure that all these restrictions, all these guidelines by the MOH, they are actually seen to? And haven't we seen the president himself break these guidelines?
Well, I would be surprised when any political leader, turn down to the rules and the guidelines. I think the political nature, learning from political manners, has been that our politicians are at the forefront of violating a number of regulations.
Yes.
Not only on health regulations as stipulated by the ministry. But then it's important to allude to the fact that you ask, what is it? Is it a culture? Is it an acculturation? But then the answer is yes. That is what we are always seeing, that in our political culture, we preach what we do not follow.
Yes.
It's just a hypocrisy. I'll give you an example. That the head of state the president stands out that the head of government and the head of state is first of all a political leader. And you've asked that, has he led? He himself was in the tour to Kisumu.
Yes.
And a number of counties. But then in a number of times, the president has not been the one saying, even as I am here, you guys should follow these regulations as are stipulated.
Yes.
So in one hand, acting as the head of the executive and reprimanding the cabinet secretaries, including the secretary, the cabinet secretary for health, he poses an image of of a personality, of a leader who is serious in tracking down the COVID.
Yes.
Then as a politician, when he goes outside, he purely throws up, his stature as a leader and the one who actually should give an image that is the leader. So now, where are we as a country in terms of political leadership? And I like the fact that, Dr. Jacqueline mentioned that even if it's on us as a political leadership, from the national level to the county level to the village level,
yes,
it's quite important for our own leaders to pose in nature that I am taking the leadership, be it in the village level, be it at the county level, be it at the ward level, that we must begin to be very serious in terms of, containing the spread of COVID. It has been announced that the spread is taking a community way. It's actually spiraling down to the community.
Yes.
Therefore, it bequeaths the leaders who are the grassroots. And even as we, propose measures to have the community health workers, I'm going to tell you that the community health workers, some of them, as we see, especially in the informal settlements, even within the city and the villages, some of them are not well equipped with information, leave alone them being armed with instruments and, and all the, the equipments to deal with COVID.
Yes.
Information, first of all, and I've seen the work of civil society organizations. I've seen the work of organizations trickling down to the community level, trying to, give the information, provide, areas where people wash their hands and education. But again, when the government is proposing that we have, our home-based, care, Elijah, what I would ask is the government throwing their arms in air and saying, we are throwing it back to you, people, back to your houses, and with the health system that is not really well equipped at the village level?
Yes.
What are we staring to as we proceed?
Pretty much. Obogo, I just want you to hold your thoughts there because I want to bring in Mr. Kimutai Simon, the chairman of Matatu Owners Association. Good. But just before we do that, I want to go for 1 minute on exactly why our audience is blaming you as an angry man this morning. Mr. Kimutai, let's play that bite, go back to Daniel, and then come back to you this morning. Pretty much. That's the big question that Mr. Kimtai is asking this morning. I would ask you, and I will start like this because then you have a panel that is going to come to you as well this morning. And I'm going to start with Daniel just after you give me your comment. Mr. Kimtai, why are you angry?
Well, thank you. My reaction was brought about by discrimination.
Yes.
The government has opened up other areas of business doing.
Yes.
And if the SGR, which provides the same service as we do, SGR is a government-owned entity, railway is the same, and it's providing public transport services.
Yes.
Then why discriminate against us? That's what my argument. And now we would want to indulge the professionals.
Yes.
To tell us, when I'm 1 meter away from the other person, as I have assumed, that is exactly the area where you want to dwell on.
Yes.
And there's somebody else who's 1/2 meter away from me, and I have put on my face mask in the right place, and he has done the same.
Yes.
What's the difference? Because 1 meter and 1/2 meter.
Yes.
If there was any spread of infection, then it should be even 3 meters.
Yes.
As it has been put all the time, then I argue from a business point. And in the SGR, people are just shoulder to shoulder. In railways, the DMUs
Yes.
which were introduced,
Yes.
shoulder to shoulder. So it doesn't make much sense to allow other areas. That was our argument.
Pretty much.
If then
Yes.
Railways, or rather SGRs, are the same,
Yes.
they are less than 1/2 meter because they have standing provision, then why the discrimination?
Pretty
That's
much. Mr.
our
Kimtai,
argument.
I'm sorry.
Don't
I'm
forget,
sorry.
just 1 minute. Don't
Yes.
forget.
Yes.
I just want to say one thing.
Yes.
Public transport matatu is a private entity where there are no subsidies, where we have no stimulus, while SGR is a government and railway is government. My arguments were on two sides. Provide subsidies, as it is practiced in other jurisdictions,
Yes.
so we can adhere to this. But if you let us not able to even meet our operational costs, the industry is faced by a collapse. So what happens? So it's a government to either decide on this. We've asked for, there are two alternatives. Allow us to carry maximum, and we observe the other protocols, the face mask, sanitization, fumigation, or provide subsidies, and we still observe all the protocols that have been recommended.
Pretty much.
That is my argument.
Pretty much. Now, Daniel, you were laughing when Mr. Kimtai was saying, well, I mean, if I'm putting on my mask and it's working, then why are you telling me to social distance? That is your question, Dr. Nyani Victor, this morning. We're going to come to you before we travel back again to Mr. Kimtai. Why were you laughing?
I think my attention has been drawn by his concern.
Yes.
And it's legit, because I just forgot to say that even as the government was relaxing measures on some other sectors,
Yes.
I think it's quite unfair for, and I don't know what really the professionals probably might tell us.
Is unfair a word that we want to use right now?
Yes, I think it is, because
Owing to the infections in the country.
really look at this.
Yes.
For example, the bus, what takes in place in the bus, it's something that we haven't really seen, because the businesses and the activities that takes place within the open spaces like the bus, I don't think that they're well really monitored the way we are monitoring our public, the matatu sector.
Yes.
And in one thing that, not really laying my professional guard, I'm saying that the government and the health professionals could advise us.
Yes.
Why did we relax measures, for example, on the bars and on the churches and on other social gathering, even in the political gathering?
Pretty much.
Which much is so do I say, the situation could be so contagious in a gathering like political gathering compared to the Matatu sector.
Yes.
And therefore, when Mr. Simon talked about, his rage in terms of being disappointed, I think I would really understand that in the dimension that this is a sector that you really own so much, especially to Kenyans who really cannot afford, to have their own other private entities of travel. So I think I agree. But of course, not really laying down the guard that, the government should not really relax so much, especially on public transport sector.
Yes.
But I think they should review really what is even, you saw the other time that even recently, that in some members of county assemblies have been hauled out in bars. Elijah, you don't really know. We don't really know the number of people that are in these open spaces. We don't know what really takes place in there. And you could even be surprised that even some of these numbers that we are seeing could be attributed
Pretty much.
to that which we don't monitor during the night.
Yes, I've got a final question for you, Daniel, just because we're trying to find time this morning. Dr. Ngani Victor, just 15 seconds, if you may. Well, if I'm putting on my face mask and it's working as a professional, why should I social distance? Because that's the question that Mr. Kimtai is asking.
Well, ordinarily I agree with Mr. Kimutai, but then on this one I completely disagree, and not only that, I find the sentiment dangerous and it will cost lives.
Yes.
I think we look at it that way. Principally because COVID is a droplet infection mainly before the airborne function.
Yes.
And the bigger the droplets, the higher the risk of infection.
Yes.
The closer you are, the higher the risk that you get those droplets.
Yes.
And I think let us be very clear. There are people dying because of transmission. Transport is necessary, yes, but then let us maintain social distance. It is a risk of infection significantly.
Pretty much. Let me just bring in Dr. Jacqueline Wanu before we travel back again to Simon Kimtai this morning. Yes, the question is, what is your opinion on that? Social distance? Don't put on your mask. Put on your mask. Don't social distance. Where do we stand? Because that is what gets into an economic argument this morning. 15 seconds, if you may.
The ways and the measures provided are effective. So
yes.
Please put on your mask. A face mask is one, you remember there was even a point it was said, you'd rather, it doesn't matter what kind of mask you have, as long as you have a mask on.
Yes.
Because of what Dr. Victor has said. These are droplets.
Yes.
That is one. You cannot say that you won't keep the distance because you're wearing a mask.
Yes.
That is just a lot of miscommunication. Something else I'm going to add, if you look at the statistical infection rate of somebody, and I wish people would go online. People need to read.
Yes.
People need to be taught.
Yes.
When one person is wearing a mask and the other person is not wearing, when both people are wearing a mask, and when two people are not wearing a mask.
Yes.
The infection rate among those three distributions. Thank you.
Pretty much. Let me just bring in also Peter. Well, put on a mask, don't social distance. I mean, what do we stand? 15 seconds, if you may.
We are supposed to put on a mask.
Yes.
Okay, there's this analogy like you have someone with a trouser and another one with a trouser there.
Yes.
Someone without a trouser, and they are like urinating. Now I'm giving the analogy of the mask.
Yes.
Okay?
Yes.
Now, the person with the trouser is not going to like splash away. It's not going to like splash away. You get it?
Yes.
Now, mask is important. Social distancing is important, though it's not obviously observed, but personal caution is supposed to be observed. You're supposed to like sanitize.
Yes.
You're supposed to like wash your arms. Even this mask you're putting on, you're supposed to like have them like when you're handling your mask, it's supposed to, you handle it with a sanitized arm.
Pretty
Otherwise,
much.
you're still going to get the disease.
Yes. Let me, because we only have 2 minutes, let me get back to Kimutai this morning so that we just take 15 seconds each to respond to the conversation point that the president has given us. Mr. Kimutai, I've got this question from one of our watchers who's saying, he should not lie that he hasn't seen some members of his association that are a total disregard to some of the measures that they're operating under. Have they taken action even before he complains about this is discrimination? 1 minute, if you may, sir.
Thank you. One thing is that we are all careless. The infection has been I mean, there's a surge because of carelessness
Yes.
and perception.
Yes.
And we consume what has been put in either by the government officials. And our argument was not about, I think we should get involved with professionals more than getting information that has not trickled down, that does not trickle down to people. As Jacqueline had put, I think it's very important that let this be taken to village level. You know, lack of information can put us argue because we don't have full information about this. So it's very important that we have professionals talking, as opposed to, you know, when we see there's a perception that it could not be real, COVID could not be real, and it could be like, you know, why is there discrimination? So those are the basis of arguments. But when we listen to professionals
Yes.
who actually handle these cases, then we kind of say now that that's a difference between when we get other information, either being given from certain quarters. So it's very important that the information is given all over. And we don't forget that people must take up personal responsibility. Those using the service in public transport must ensure that they are ready to have a journey, maybe seated next to a person who has COVID without perception. So it's important that every person takes up responsibility in public transport. It's not only those who are giving the service, it's even those who are using the service. They must take care of themselves.
Pretty much. Now, let's therefore cap this conversation. I'm going to give each of you 5 seconds because, well, we do expect that meeting next Wednesday. Just 5 seconds so we step out of the studio. Good. That we shall not be compelled to roll back the easing of the restrictions that Kenyans enjoy today. Mr. Bogo, just one answer from you. Should we roll back the restrictions?
No, I don't think it's necessary. I think the most important thing is like when we have eased up the restriction, one is personal responsibility. Secondly is leadership with the responsibility. And I think third, that the way we've said, it's incumbent on professionals. And this is what I want to wind up with.
Yes.
When we are listening to professionals, it should be listened to both citizens and both leadership. What is informing the ease of the restriction and the containment measures is based on the advisory. It is important for the professionals actually to tell us the formula why some sectors would be so much restricted,
yes,
while others are so much, really they're relaxing of measures. So this really guides the country in terms of, in terms of professional outlook. And I think lastly, to the President of Republic of Kenya,
yes,
one of the things that I keep on saying is that there should be somewhere the backstop with it. I think the backstop with him, when we are going to see unilateral decisions that are made by different political leaders and he relax on the measures, then I think he should take responsibility of the leadership.
Pretty much. Jacqueline, yes or no? That's the only thing I'm going to give you. We are out of time. Should we roll back the restrictions?
No.
No. Dr. Victor Ngani, should we roll back the restrictions?
To some degree, the surge is because of relaxed restrictions. Close the bars. There's no point in having 200 people in a funeral. It's not an economic discussion. We should roll out some restrictions.
Pretty much. Peter Muturi, should we roll back the restrictions?
We should not.
We should not.
Life is very hard.
Yes, Mr. Kimutai, should we roll back the restrictions?
No, we shouldn't. I've just lost a relative.
Pretty much.
And we are yet to bury him to COVID. We lost him to COVID. So it's real.
Pretty
and
much.
We don't have to play about that. Now I think as it's been mentioned, backstops.
Yes,
he has to make sure that
pretty much. I would like to say thank you very much for making Business a success today. My name is Simbalajo Shawalski. I get full of this conversation 2146. So let's wait for Wednesday therefore for that meeting as well. Good morning.